Nick, can you come online? Are you able to come online?
Yes, I've joined. Can you hear me okay?
Yes. So what I would like to do is I'm going to bring your slides up, and can you explain this is complicated. What's going on here in this slide at this point
Yeah.
that
So the immune system, as Keith mentioned, is really complicated. There's a lot of interplay. And we have what's called the innate response, which is responsible for really fast, rapid. Think of it as your rapid reaction force. So they recognize things that don't belong, bacteria, viruses, cancer sometimes too, but they don't remember anything. Then we have the adaptive response that has the ability to remember. So they learn from vaccines, prior infections, and they serve as a long-term memory that help recognize this in the future if something comes back. What's really important for this interplay is what's in the second bottom black box is that interface between dendritic cells and T cells. And that's really where these two teams communicate. And they say, look what I found. And I'll mention this later too. But it's really important that these two teams work together to make one really strong immune system to fight cancer and fight anything that doesn't belong in the body. And that's really the goal, is finding something that doesn't belong, what is abnormal. So that's the general idea here of looking and linking everything together so it works as one strong team together.
so we're talking about there's a fast response team, and then there's this team that has a lot of memory, and they're there just in case something comes back then.
Exactly, exactly. And they learn from each other with that.
Okay, but but how do you keep this in balance? What do you mean by keeping stuff in balance? What does that mean?
Yeah, I mean, that's a great question. So in the body, your body has to recognize that you are you and that you belong, and your cells, like your liver, your heart, your lungs, your intestine, that they're normal and that they belong, and this is home, is what I say to my patients. That your immune system has to recognize that's there. I mean, it can't attack, it shouldn't attack. When that balance is off, and it doesn't recognize what belongs, that can cause autoimmune disorders. So thyroid disease, it can cause adrenal disease, lupus is another great example too, where the body forgets what is supposed to belong and starts to attack and destroy those tissues. The other side of that is when the immune system is too lazy or just too tolerant of anything and doesn't recognize cancer as cancer as being different, doesn't belong, and actually doesn't kill off the cancer cells very early on when it first detects them and lets it grow. So really, we need a balance of your immune system saying your organs belong and they're working, and we'll leave those alone because they're here, they're you, they belong. But we also need it to be um, vigilant enough to pick off those cancers really early before they become a problem too. And anytime the immune system is off in that balance is when we run into problems.
Mhm. Now, you know what's interesting here? I don't think that the majority of people who are online and the majority of people out there recognize that we have small cancers already in our body, and then the immune system is constantly keeping everything in balance, like you're saying, in check. And then not that many people know that our immune system is constantly killing cancers.
It's really incredible what the immune system does and what the immune system takes care of before it becomes a problem. And that's really the great thing about the immune system, is that it picks off these early cancers when it's one cell, two cells, microscopic, and you don't even know you have it. And that's really important with that balance. And that's the ideal situation with perfect balance, where your immune system is able to take care of those things before it ever becomes a problem.
Okay. So now this is interesting. You're going to touch upon just briefly about I talked about these T cells, but then
Mhm.
you came back and you talked about these early responders. So these are the early responder immune natural killers. Can you tell us a little bit about these and what role they play in protecting us against cancers?
Yeah, so natural killer cells are part of that early responder, those rapid response forces, and their job is really to do surveillance, to look for things that don't belong, in particular cancers. So we know that patients who have natural killer cell deficiencies or are immune suppressed are more likely to develop cancers. That includes prostate cancers as well, as we can see highlighted in the red box there for the number. It's higher incidence or higher number of patients in compared to a patient with a normal immune system that developed prostate cancer. So it's really clear that these NK cells are important. They run around and I say they check ID badges on all the cells. And if the ID badge doesn't match or it looks a little funny, the natural killer cell destroys that tumor cell. And that's
That's,
the early checkpoint.
I think that that's a good example, running around checking those badges, to make sure that you're the appropriate cell that's supposed to be in the body. Now, do you know of any, is there a relationship between NK cell numbers and maybe certain ethnic groups, or it doesn't matter? This relationship between NK cell number and cancer is the same for everybody throughout the globe.
As far as I know, there are no differences between a racial or ethnic background and the number of NK cells. So I think, not that we know of, there's been a lot more interest in natural killer cells, and I think there's going to be a lot of research coming out in the future about natural killer cells. I like to say that the data behind natural killer cells is about 10 years behind that of T cells. And
Yeah.
so there's just a lot more coming out. So we may learn things, or things may even come out soon that we didn't know. But as of now, I'm not aware of any data showing that difference.
So that was important is because now the new discoveries and these new discoveries, especially coming out of your lab, are going to be impactful for everybody, right?
Hmm.
Okay.
That's our hope, is that these new things that we're developing, new therapies we're developing.
Well, I mean, we saw them at the bench. Hopefully, you're right that we can translate all the information that we did research on like 20 years ago, 20, 30 years ago, can
Hmm.
apply directly now. Now, we talked about this concept about surveillance. Explain to us how the immune cells are surveying the tissue and then looking for these cancer cells.
Yeah, so let's start in that upper left corner where we see normal cells, those kind of gray brown shaded cells. So those are our normals. By transform, we mean that it turns cancerous. So those are going to be those red cells. We go down to that third tab or that third layer there, we see that the immune system is there starting to check things out and it's starting to recognize what is going on. The normal immune system would go to that left towards elimination where it would destroy those transformed cells and everything is back to normal. But what happens when you develop cancer, or it would be that equilibrium where it stays stable, where they start to recognize and tolerate each other. But what happens when you actually develop a tumor that's visible happens when you go to the right with that escape, where the tumor is growing faster than the immune system can recognize and destroy it, and then it starts to grow. And so that's when we get cancer that we are able to diagnose currently with our currently available medical technologies and testing. And there's a bunch of different ways that a tumor can eventually escape and outsmart the immune system. And I say it outsmarting because I say tumors are smart. Tumors learn. They learn how to escape because their goal is to survive. So one of the first things is if your immune system is recognizing something, the tumor deletes it and it says, nothing here, you can't find me anymore. You can prevent the immune system from actually getting into the tumor. So prevent showing what's found by the immune system. So it just blocks that interaction. You can also surround yourself by basically bodyguards. So tumors have these suppressive cells that they surround themselves with many times, and it prevents the actual killing cells, the natural killer cells, the T cells that destroy tumor, prevents them from doing their job. So I think of it as like bodyguards for the tumors. And then finally, the tumor is able to wear the immune system out by these nothing to see here signals. And that we'll talk about a little bit more in our mechanisms page. But there's a bunch of different ways. Like I said, tumors are smart and they use all of these methods to try to escape the immune system to try to continue to grow.
So now, so they escape. So this is a term that people hear about cold tumors or this tumor environment. Could you help us understand, just kind of at a high level, what you mean by
Mhm.
cold tumor or this tumor microenvironment, or how in that area that the cancerous cells or their blockers are able to prevent the immune system from working.
Yeah, so we often call tumors hot versus cold. And when we say hot, it means there's a lot of immune cells in that tumor working on killing the tumor. It's very immune active. So think of activity like body heat or like sweat. Like if you're sweating, the immune system is in there, it's really active, there's a lot of it. When a tumor is cold, there's not much immune system, not many immune cells that are actually infiltrating into that tumor. And I think a couple different ways that we can overcome this cold tumor microenvironment. One is Sipuleucel T, which was FDA approved in 2010. And
Right.
this really focuses on that interface between between the two sides of the immune system, between the early response force, which is a dendritic cell, and the T cells, which are the memory cells. And the best description I have is that the early immune system hunts around, finds this, or this they do it in the lab, in this case with Sipuleucel T, and it presents to the other inside the immune cell, said, look what I found. Remember this, and if you see this, destroy it. And they present it with a piece of tumor. And that's how they educate the immune system. Immune checkpoint inhibitors, so like pembrolizumab, which is FDA approved for a very small number of patients, only about 3% of patients with prostate cancer, that blocks that nothing to see here signal. It's also what I refer to as an invisibility cloak. So it blocks the invisibility cloak of the tumor and allows the immune system to see the tumor again. There's a really new class of medications as well called bispecific engagers, and there's two parts. One sticks to the tumor, one sticks to the immune cell, and it doesn't let the immune cell go until it destroys the tumor. And there are many experimental drugs in this space, but none of them are approved for prostate cancer. And then finally, experimental wise as well, are chimeric antigen receptors. And I like to call these like Pac-Man. So it retrains your immune system to go around and chew through tumors very specifically. That's the best visual I can give. Almost everybody knows who Pac-Man is. And these are all experimental as well. So nothing is approved in that space, but it's an exciting field. But there's lots to go.
So let's be clear. So what you're saying is that there's already immunotherapies that are approved. And you mentioned this Sipuleucel T, and it
Mhm.
goes back to 2010. So
Correct.
immunotherapies have been in existence, and we've been using them to fight prostate cancer or slow the progression of the cancer.
Mhm.
2010, that's 15 years.
Right. Yeah, it was approved. It was actually the first cellular therapy that was approved was Sipuleucel T. So that was a breakthrough in the world of prostate cancer and that was really the first in the field using using a cellular therapy.
Hmm. So that's FDA approved. So that's out on the market. That's something that our survivors need to recognize that exists. And then these checkpoint inhibitors, that's an interesting area. I think, didn't President Carter back in 2014 use something like this?
He used a slightly different one, but he used a similar drug that was also called a checkpoint inhibitor. President Carter publicly was known to have melanoma, a skin cancer, and that is a very hot tumor, and that is treated typically very well with this type of tumor. So blocking the nothing to see here or removing the tumor's invisibility cloak.
Okay. So we know that, and I use that as an example because the technology is not new. It's just maybe new to the prostate cancer care or treatment,
Mm.
but it has been used before. So people in the audience should not be afraid. I mean, the Sipuleucel T, SIP-T, that's a different story. I mean, that was specifically for prostate cancer. Now, what's exciting is that's what we have now. But you were talking about some other things like bispecific engagers, all these fancy words. It's like, and they help bind the immune cell to the tumor. Tell me
Correct.
that.
Yeah, so these are actually approved in multiple different types of blood cancers, the bispecific engagers and chimeric antigen receptors. So those were first approved in the like the mid 2010s, and we have multiple products now that are approved for blood cancers. So for lymphoma, acute lymphocytic leukemia, for multiple myeloma. So they've demonstrated that these have worked in blood cancers. We haven't gotten that technology to translate yet into prostate cancer or other solid tumors. So still investigational in that space. but trying to learn how do we apply these and maybe make them work in the future with solid tumors like prostate cancer.
Okay. So now that's interesting. These chimer antigen receptors, these Pac-Man-like things. Can you tell us about that?
Yeah, so imagine, how you run Pac-Man through the video game there, and Pac-Man chews up and destroys the enemies, whether it's the ghost or the other parts on Pac-Man. What we do is we take out a patient's blood cells, just with a big IV, and then we send it to the lab, and we basically teach those cells. We give them a receptor on there that teaches that cell specifically to kill and destroy any tumor that receptor sticks to. So that's
Mhm.
how it works. We've trained them, so they have very much a one-track mind, you could say, for everything that we have. It goes after one target, but it's a target that we know is very highly expressed on our tumor of interest. So again, leukemias, lymphomas, multiple myeloma are really the cells are the types of tumors for with the CAR T right now. But it's a really exciting space. They've have multiple approved products for blood cancers, but we haven't gotten that breakthrough yet in solid tumors.
Okay. So what I want to do is um now you've given us some background and said